This will be our second round of Trainee Lightning Talks. It is sponsored by Silver sponsor Queen's University. The Trainee Lightning Talks highlight key research findings and mobilizations that impact the neurodevelopmental disability community. And before I forget, there is one thing I did want to say about the preceding panel. You know, in the name of Luke, I wanted to thank from the bottom of my heart Rachel Martins for making all of this possible. And I know that you got a lot out of it. I know you put a lot into it. And I'll have more to say about that in my reflections at the end of the lightning round. But I did want to mention that before we move on. So we're going to be moving over to our moderator, Dr. Jill Zwicker. She is Associate Professor in the Department of Occupational Science and Occupational Therapy at UBC. Dr. Zwicker's 30 years of clinical experience as an occupational therapist, combined with graduate training in neonatal and pediatric brain imaging, have contributed to her building an internationally recognized research program on developmental coordination. And I'm going to give Jill and the trainees the virtual floor now with round 2 of our lightning talks. Over to you, Jill.
Thank you so much, Dr. Goldman, for that introduction. And I just want to echo your thoughts about the panel, and just to say that I also participated in the family engagement and research course together with a parent of a child with developmental coordination disorder, and it was a very valuable experience. So thank you for joining us today for our lightning talks. At this point in time, I'd like to introduce our speakers. So I'll first introduce our 4 speakers, then we'll hear from each one of them and their presentations, followed by a question and answer period. So as you listen to the talks, if you have questions, please type them in Slido, and we'll be sure to try and answer all of your questions. So with us today, we have Darcia Matula, who's a research associate at the University of Calgary, working with Dr. Jennifer Zwicker. We have Samantha Wong, who is a master's student at McGill University, working with Dr. Eve-Marie Quinton. We have Flora Wong, a master's student at York University, working under the supervision of Dr. Jonathan Weiss. And we have Nancy Lockwood, who's the manager of the Fetal Alcohol Resource Program at Able2 in Ottawa. So our first talk is from Darcia.
Hi, I'm Darcia Matula, Research Associate at the University of Calgary School of Public Policy. Today, I will be presenting the baseline data as part of the evaluation of the care coordination program implemented at the Alberta Children's Hospital. The picture on the left was drawn by a caregiver to represent their experience in navigating the NDD-related support system. Caregivers navigating this system face system fragilities, as well as inconsistent communication and inconsistent policies across continuum of care. To help caregivers manage these barriers, the Care Coordination Project was developed. Each caregiver enrolled in this project is assigned a care coordinator. Together, they work to develop individualized and needs-based care coordination plans to promote access to services, as well as family empowerment and family self-management. To date, we have recruited 55 caregivers to take part in our study. The inclusion criteria for this study is to have a child between the ages of 0 to 17 with an autism and/or an ADHD diagnosis, followed by a subspecialty clinic. Caregivers complete surveys at the different time points to evaluate progress in terms of care coordination, parent stress, quality of life, health and social service utilization. Caregivers complete these surveys at baseline, 4 months, and 12 months. The data collected so far show us that the majority of the children enrolled in this program have an ADHD diagnosis. The majority are male. The majority live in a household with 2 caregivers. However, on the other hand, the majority of caregivers surveyed are female. Furthermore, our data shows us that despite the complexity of needs that exist for this population, 45.1% have not received any treatment for their developmental. However, the service utilization in terms of physician visits and use of respite remains high. The use of respite ranges from 0 to 360 days in the last year. Furthermore, our results indicate that when comparing this group to caregivers who have children without disabilities, the average happiness score is lower in the group, the stress levels are higher in this group, and a significant amount of caregivers report some to a lot of problems with their mental health. The results that we've presented today are the starting status for this family. We are currently collecting data for the 1-year mark, and we expect to see the real impact on the entire group as we complete all collection for the caregivers who have reached the 1-year mark. This research is important given the role of care coordination in reducing the barriers caregivers face and promoting access to services. Thank you.
Hi everyone, my name is Samantha Wong from McGill University, and today I'm going to talk about neurocorrelates in synchronization in children with autism. Social motor synchronization is found to be one of the diagnostic characteristics in autism spectrum disorder that's under the broader definition of autism spectrum disorder. However, there's need for more research for relevant neurocorrelates to be clinically applicable. So my upcoming projects are going to look at the magnitude of brain activity during synchronization and whether or not there's neuroplasticity in synchronization. EEG is a really powerful tool that allows us to measure brain activity during a task. In particular, the recent use of frequency tagging techniques allows us to look at a particular frequency that's been shown to represent synchronization. So my first hypothesis is that there will be behavioral and neurophysiological evidence for less synchrony in children with autism. And to do that, we'll recruit 2 groups of children with autism or typical development between 8 to 12 years old, and then we'll invite them to do a task with an experimenter where they will produce movements to synchronize with each other while measuring their brain activity with EEG at a particular frequency. And then afterwards, to look at neuroplasticity in synchronization, we'll look into music because music has been shown to be a strength in the population in all of these areas in previous literature. And in particular, group percussion training has been shown to induce improvements in motor control and increase functional connectivity in premotor and motor regions. There's also studies showing transfer effects to social effects and social skills and synchrony. And therefore, my second hypothesis is that children with ASD will show improvements in synchrony after group percussion training. To do that, we'll follow up with the ASD group in our first study for 16 weeks to account for natural maturation, and then invite them to group percussion training for another 16 weeks. And a bigger change score in the performance and the neurophysiological effects from the same task as our first study between group time point 2 to 3 as compared to time point 1 and 2 will show that group percussion training is effective in improving synchronization. And all of this is important because it shows that EEG can be a low-cost diagnostic method in the population. It contributes to better understanding to ASD as a group of, as a form of neurodiversity. And lastly, it validates how strength-based approach could be valuable when choosing an appropriate clinical intervention. And I'd love to discuss with anyone who's interested in this topic at my upcoming presentation. And I thank you to my supervisor for her support.
Hi, my name is Flora, and I'm a master's student at York University under the supervision of Dr. Jonathan Weiss. One of the concerns we know about children with neurodevelopmental disabilities, including those with autism or ADHD, is that there are greater risks for mental health problems, including anxiety or depression. Before COVID-19, our lab was investigating the impact of a spy-themed CBT program known as Secret Agent Society Operation Regulation, teaching emotions regulation skills and social skills. Due to isolation and policy restrictions, we had to stop our research trial. However, we still have the responsibility of providing continued care, especially because social isolation may lead to exacerbated mental health problems among families. We had to quickly adapt our in-person therapy for virtual delivery. This research findings I will present on will be from qualitative interviews from therapists about lessons learned from this abrupt interruption. Here are the 4 main themes we pulled from our interviews from therapists. Firstly, they really valued the online training from our clinical supervisor and from our SaaS developers in Australia, where they learned to troubleshoot issues that might come about related to virtual therapy, such as technical glitches, privacy issues, setup tips using their camera and their space. Therapists found this really helpful in terms of building confidence and being comfortable with online delivery. Second, building rapport was possible. For parents, constant communication was key, including sending weekly emails and debriefs. And for children, incorporating child-specific interests such as their favorite online game and sometimes incorporating their pets surrounding conversations on emotions was also really helpful. One therapist said, virtual Zoom backgrounds they use including using high fives and fist pumps at the camera. Next, therapists identified strategies to deal with challenging behaviors, including using more explicit reinforcement, frequent breaks, and validation. Another therapist said, I had to do a lot of validation for him. It was sort of like emotion coaching, I had to say. I had to say, I know this is hard. This is hard for lots of kids. You're doing a great job. Therapists were able to help children feel at ease during these challenging moments. Lastly, therapists reported adapting the program, such as shortening sessions, changing the order of therapeutic activities, and modifying activities to make it appropriate for online. One last therapist said, be very flexible to what they need, doing what you can that will make things most beneficial for them. Therapists valued being client-centered, flexible, and not necessarily attached to the manual. In summary, it is possible to adapt a CPP program online, and next it will be important to study the health outcomes of this online intervention. However, during the pandemic, it is beneficial to use these lessons learned to inform future online training programs. Thank you.
Hi, I'm Nancy Lockwood, and today I'm going to demonstrate how the Fetal Alcohol Resource Program at Able2 in Ottawa, in collaboration with Kids Brain Health Network, has grown from a pilot project to a multi-systemic approach to providing wraparound care to children and youth with FASD and their families. So we launched in 2015 as a pilot project with 4 part-time staff. We all had lived experience raising children with neurodisabilities, and we formed an advisory committee of stakeholders. And together we decided on 4 key pillars of what we were going to do. So we decided to offer customized FASD education, build capacity at our local agencies, offer navigation support to people with FASD and their families, and also a research and evaluation component. So in those early years, we discovered that individuals and caregivers were finding they felt better supported. They reported decreased stress and more community connection. We started to get provincial and national recognition as a trusted source of FASD education and received invitations for presentations to the Senate of Canada and other groups. We've launched an annual FASD symposium. This model's been used as a template for KBHN's Navigator program, special events, and we have fully bilingual services. Then starting in 2018, we had rapid growth. The Ontario government launched an FASD worker program, and CHIO outsourced to us to deliver that in Eastern Ontario. This allowed us to offer clinical services and professional consultation, hire more expertise. We helped design the FASD worker program for the province, train their workers. We host knowledge exchanges for them. We had an advisory role on the Ontario FASD website and their provincial support groups. And we've brought in experts to train physicians in our area. And now as we move forward to this next cycle, we are going to offer even more care. So here's a little sneak peek at our poster. We hope you come to see it. And you'll see we're having true wraparound service support for people with FASD. So As a microsystem, we're offering these individual supports, then we support the family, the school, connect the systems together, continue building our capacity, but also starting to inform public policy and prevention and awareness efforts. So come see us, we'll talk to you more about cycle 3 and how we're going to be evaluating this next cycle with our KBHN Trainee Mode Champagne. We'll talk to you about the support we've been giving families and stakeholders, and the data we collect is going to inform policy, demonstrate the relevance of this program, and show that communities could benefit by replicating the program and expanding it to all neurodevelopmental disabilities. Thank you.
Thank you so much, Darcia, Samantha, Flora, and Nancy, for your wonderful talks. And for those of you in the audience, these are just sneak peeks of more information to come. So please join us for the poster session shortly after this talk. I'll open the floor for questions now. So if you have any questions, please post them on Slido. And we do have a question to start, and this is for Flora. Can you tell us what some of the challenges might have been for therapists to transition from in-person to online therapy?
Absolutely. I mean, I would say maybe 2 things come to mind. One being that therapists did say that although they were able to provide benefits, and especially providing benefits and hearing families benefit from the program, that there were some kids that were easier to work with than others. And therapists had mentioned the kids that were a little bit more talkative, a little bit more verbal, it was almost easier for them to get a sense of how they were feeling. If there's any challenging behaviors, they could customize the program in that moment. So that was easier versus kids that were a little bit more reserved. And the other piece that therapists mentioned was the idea of speaking and experiencing that same emotional space. So of course, although therapists did feel that they were able to deliver the strategies, that emotional piece space was missing. But at the same time, because this was a child program, but parent involved program, parents were still there with the child in the room. And in that case, it was actually helpful because parents were almost more of a co-facilitator in this program, more so than would be the case in traditional therapy.
Great, thanks for that. Yeah, definitely has been a bit of a transition for us all. Darcia, I wonder, with your study, with what you've obtained to date, have any findings been surprising to you?
So the findings that we've had so far have really confirmed what we have seen from the previous literature. When parents first come to the care coordination project, they are overwhelmed in terms of the pathways to the existing supports that do exist. They don't really know where to start. So they really come confused and overwhelmed. And they do find that having a care coordinator to be there with them and treat them as a partner to help make sense of this huge puzzle, to figure out which services exist and which services are adequate to their children is really beneficial to them, which really confirms the previous literature that we have seen, that parents really do have difficulties in making sense of the various services that do exist. And this confusion often leads to a very low uptake of the various benefits and supports that are out there.
Right. Well, thank you for that. Hopefully your research and your knowledge translation will help in that regard. Nancy, I'm wondering if you could tell us perhaps what are 2 main issues that you find your families are facing, and how might you help the families with these issues?
Well, during COVID, there are 2 issues that really are at the forefront. So one is social isolation, both for caregivers and for people with FASD, and the other would be managing challenging behaviors. So as far as the social isolation, we know that's an issue at the best of times, but right now, the first thing we had to do was make sure that all of our clients had access to technology and Wi-Fi. So we assisted with that. We run a lot of support groups, weekly support groups for people of all ages with FASD and for caregivers. So that seems to be a really big lifeline. We find the youth that we support tell us that it's the highlight of their week, but it's building connections. We pay adult mentors with FASD to work with them. So that is one strategy we're using with caregivers. It's a lot of group support, peer support. A lot of people who work for our program have experience raising people with FASD, so that helps. And then as far as challenging behaviors, that's a really big issue, and it seems to be exacerbated when you have people under one roof with COVID. So a lot of it is working with caregivers to identify, what's beneath that behavior. Is it something biological? Is it sensory? Is it anxiety? So we try to equip the parents or caregivers with strategies. A lot of people we support too are even living on their own or on the streets or in care facilities. So it isn't even always with caregivers. We also have chosen for a theme for a symposium this year how to manage challenging behaviors, because it is such a prevalent topic. So we've got some really good speakers to share information.
Great. Well, thank you so much, and thanks for all you do for families. Samantha, I was very interested in your study, and I'm curious, what if you don't find what you expect from your hypothesis?
Thank you for the question. I think it's equally valid to find a no result, and that just means that we'll have to look at the problem from a different angle and try to understand, I think because there are two parts in my presentation. So there's the neurocorrelate part and there's the effectiveness of music intervention part. So I think it will mean different things. So for my first study, if there's no difference in terms of that particular neurocorrelate that we're looking at, then it could point to other things that we can look at that could contribute to what we see in this population. And then in terms of music intervention, if group profession training doesn't work, then we might look into modifying certain parts, certain aspects of the intervention, like group versus one-on-one, etc., or choose another type of music intervention.
Okay, great. And just Darcia, another question for you. What aspects of care coordination do you find families value the most?
The aspect that we find that caregivers value the most for care coordination is being treated as a full partner in caring for their child. So being informed every step of the way of the various treatment options that are being considered and what the path towards treatment will look like for their child, and also being part of the various decision-making processes towards that treatment. So besides having someone to navigate the system with them, they really value the fact that, okay, we have one person that is helping us make sense of all of this, but our voices, our concerns are heard, and the individual pressures and challenges that our families and that us as caregivers face are also considered in the whole spectrum of things.
Great, thank you. And Nancy, we have a question of what have been some of the facilitators in scaling up your project from the pilot study?
I'm not quite sure what they mean by facilitators. I think, well, a lot of ways depends on funding. So it's attracting more funding partners, but it's also just really engaging with stakeholders and helping them to realize that they have a part to play in supporting people with FASD. So an example would be the education system. We know that a lot of teachers don't receive much training about FASD. So it would be reaching out to the various school boards and offering training and explaining to them even just prevalence that, they'll often say we don't have any students with FASD but we know they do. We know prevalence is estimated at 4%. So a lot of it is just reaching out, building the awareness, and convincing all these different stakeholders that they've got a role to play, and really building collaboration, finding ways we can support them and how they can support us as well.
Great, thank you. And Flora, I think this is for you. When it comes to hand-over-hand strategies, do you depend on parental assistance for the CBT intervention?
That is a great question. So we do actually have Secret Agent Society materials that one of our lab coordinators was able to actually mail to the family homes to be able to have that tangible piece. And in that case, yeah, so parents were told for every session what materials they need, and they would be the ones that would help the child in terms of playing with the different relaxation strategies, and in addition to the computer game component. So that was something that both the parents, child, and therapists were able to do online, but definitely the tangible piece and the handover supports, they were able to work with the parents, and parents absolutely loved it. They loved how much they were able to be a part of that program with their child, and lots of positive feedback about being a part of that.
Great, thank you. And then Samantha, I wondered if you could just elaborate a little bit more on the clinical implications that your study may have for children with autism spectrum disorder.
I think for my study one, because we're looking at using EEG to measure neurocorrelate that corresponds to difficulties in synchronizing with a social partner. Potential clinical implications there would be to hopefully use EEG down the road as a really effective way of diagnosing autism, or having that as a piece of information on top of what we're using right now, which is very behavioral based. I've seen in the ADOS2 where it's a collection of behaviors. So I think that could have potential implication later on. And in terms of my second study, which is to use a group percussion training to see if that could induce any improvements in this aspect of social functioning, I think the clinical implications there is that it could provide more cost-effective way of introducing giving intervention, because personally I've been in ABA therapy before. It's very one-on-one and very, it's financially pretty heavy for family, especially when different provinces have different funding support when it comes to this type of at-home support. So I think a group-based intervention will be good.
Okay, great. And might also help with some socialization aspects as well, for sure. And then Flora, I'm wondering if you could also comment, so although the online platform has been very valuable, does it work for all families, or what type of family is it most beneficial for?
So that's a great question. I mean, there needs to be more research, I would say. I think in the context of this current pandemic, parents and families, what I heard from them and therapists is that they were appreciative of having the option to do online format. In some cases, they would have preferred in person, especially for kids that might be a little bit more active, where they really need that sort of physical piece, especially like when it involves, bouncing balls and playing board games. Like that definitely would be an added factor. I think in this case, because some parents did not feel a sense of abandonment, they felt that they were able to, therapists were still able to provide some care. I think under this context, it was beneficial, and there definitely did seem to be some improvements in the children's emotion regulation abilities. But I think in terms of for all families, I think it depends on the parents and whether they're willing to, in terms of privacy levels, in terms of level of engagement with the child. Of course, families have multiple kids, and it can be difficult to have to structure enough time. And even the child's perspectives as well, whether they're comfortable being online, whether they are comfortable with sharing how they're feeling with someone that they haven't met before. So there's a lot of different factors. I just think in this context, having that option, I think really resonate with a lot of families and therapists as well.
Right. Yeah. And I guess the other piece is we mustn't forget that obviously the families that I'm talking about wouldn't be attending this conference, but not all families have access to Wi-Fi, internet, and computers, and those might be the families that even need this more so than others. So we need to try to break down that barrier as well. Well, this is coming to a conclusion for our lightning talk session. So I want to thank our 4 speakers, Darcia, Samantha, Flora, and Nancy, for your wonderful talks. And please join them in the Gather space for the poster session and find out more about their work and other trainees in the network. Our trainees certainly do provide a lot of research activity and benefit the network greatly, and hopefully in turn benefit children and families. So thank you so much, and I'm going to turn it back now to Dr. Brian Goldman.